Welcome to The Explainer. Today, we're uncovering a completely hidden, microscopic world of childhood infections. We're going to look at this right from the very beginning of life. Think of these pathogens as relentless invaders, trying to pull off this intricate, high-stakes heist just to breach a baby's developing defenses. It is a fascinating and absolutely vital topic, so let's just jump right in.
Okay, let's take a look at our developmental roadmap for today. First, we've got invasion and routes of infection. 2, congenital threats in utero. 3, perinatal risks in the birth canal. 4, postnatal hazards on the outside. And finally, number 5, defense, diagnosis, and prevention.
So to really understand this heist, we first have to understand the fortress itself. A fetus in utero has a very poor immune response of its own. It's almost entirely reliant on natural physical barriers to keep these microscopic invaders out. We're talking about the fetal membrane, the placenta, which, acts a lot like a biological sieve, and later on, maternal breast milk, which is just packed with protective IgA antibodies and macrophages.
Let's hit Section 1, Invasion, Routes of Infection. We'll see exactly how pathogens attempt to breach the baby's fortress. And this brilliantly illustrates how these microscopic invaders generally use two main infiltration routes. On one hand, you have the primary maternal bloodstream route, where infections basically sneak directly through that placental sieve. Then, on the other hand, you have ascending infections. A really classic example here is chorioamnionitis, where vaginal and cervical bacteria essentially scale the fortress walls and breach the amniotic fluid.
Moving right along to Section 2, congenital. Threats in utero. These are the infections that occur before birth.
Now, clinicians actually refer to this list as the torches lineup. You can think of it as a rogues gallery of transplacental threats. These are specific pathogens, stuff like rubella, cytomegalovirus, HIV, syphilis, and a few others, that doctors meticulously screen for. And they do that because of the incredibly severe clinical effects they cause if they manage to successfully infiltrate the fetus. One of the major primary infiltrators we see is Listeria monocytogenes. It's a gram-positive bacillus, and this particular operative uses contaminated food as its entry point. So, if an expecting mother ingests contaminated vegetables or, say, unpasteurized cow's milk, it can lead to listeriosis. This infection can actually trigger premature labor, or if it breaches the neonate, it can cause severe septicemia and meningitis. Then, we've got the incredibly bizarre multi-host infiltration strategy of Toxoplasma gondii. Its definitive host is actually the cat, which makes humans kind of an accidental intermediary. An expecting mother might ingest oocysts from cat feces, often just from contaminated soil, or she might consume tissue cysts from undercooked meat. Once it's inside, the parasite stealthily crosses the placenta to infect the fetus.
Now, what's really interesting here is the striking inverse relationship regarding toxoplasmosis. During the first trimester, the transmission risk is actually pretty low, just around 15%. But if the breach succeeds, severe disease follows 80% of the time. Contrast that with the third trimester. The transmission risk skyrockets up to 70%, but the resulting fetal damage is generally much less severe.
Timing is literally everything for a next threat. Treponema pallidum, which is the spiral-shaped spirochete behind syphilis. The danger here depends heavily on gestational age. The absolute highest risk of transmission to the fetus happens during the mother's early infection stages, particularly before 16 weeks of pregnancy. And because of that, early diagnosis for this specific invader is absolutely critical. If it manages to stay hidden during the neonatal period, late-stage congenital syphilis will present after the child turns 2 years old. This results in permanent, irreversible damage. We're talking about skeletal and joint changes, meningoencephalitis, and Hutchinson teeth. But hey, the fortress is not undefended. Modern medicine fights back with incredible precision. Doctors deploy sophisticated screening tools like the RPR and VDRL to uncover hidden syphilis. And if an infiltration is detected, powerful countermeasures are launched right away. Things like spiromevimin or pyrimethamine can effectively neutralize toxoplasmosis, while targeted doses of penicillin can completely eliminate syphilis when it's caught early enough.
All right, Section 3, perinatal, the birth canal. We're looking at infections acquired right around the time of birth.
So the crucial point here is that making it through the birth canal is no joke, and distinguishing the exact timing of a breach is super important. Early onset neonatal sepsis presents within the first few days and is usually acquired directly from vaginal colonizers in the birth canal. This one often presents as pneumonia.
Late-onset sepsis, on the other hand, presents after 5 to 7 days. This is picked up from the outside environment, think hospital instruments or staff, and it often manifests as septicemia or meningitis.
A really prime example of a birth canal invader is Chlamydia trachomatis. It's an obligate intracellular bacteria that literally sneaks into host cells using these infectious elementary bodies. If a baby is exposed during birth, they can develop severe conjunctivitis just days later, or even a dangerous pneumonitis weeks later. Fortunately, though, it is easily treated with antibiotics like erythromycin.
Similarly, we have Neisseria gonorrhea, which is a gram-negative, bean-shaped diplococci. If this bacteria colonizes the newborn's eyes during delivery, it causes a pretty severe condition called ophthalmia neonatorum, which is characterized by a purulent eye discharge 3 to 5 days post-delivery. Medical teams have to act swiftly here, deploying immediate treatments of cefotaxime and chloramphenicol drops to protect the baby's vision. Which brings us to a really vital question. Once the baby is successfully born and the birth canal is finally behind them, are they finally safe from these microscopic invaders?
That takes us to Section 4, Postnatal Hazards Outside. These are the infections acquired in the days following birth.
Out in the world, one of the most terrifying environmental threats is Clostridium tetani, which is characterized by its highly resistant, distinctive drumstick-shaped spores. These guys can just lurk in contaminated soil. If they infect an unhealed umbilical stump, they germinate and produce a super potent toxin. This toxin travels straight to the baby's central nervous system, where it blocks inhibitory neurotransmitters and causes severe, generalized muscle spasms. You probably know this as neonatal tetanus.
The surface of the skin actually becomes the next battleground, with Staphylococcus aureus, the main culprit behind bullous simpatigo. This causes superficial, highly contagious blisters to erupt all over the baby's skin. To stop it in its tracks, hospital staff have to employ strict aseptic techniques, provide fluid replacement, and immediately administer antibiotics like cloxacillin. Let's move to Section 5 and see how this all builds up. Defense, diagnosis, and prevention. This is how medical science acts as the ultimate protector.
Doctors basically construct this unyielding medical shield around the newborn. The very second a baby shows signs of a breach, like listlessness, low tone, or a refusal to feed, clinicians immediately order septic screenings. They're taking cultures from blood, spinal fluid, and urine. And they don't even wait for the results. They launch an immediate counterattack with empiric treatments like cefotaxime and ampicillin, just to broadly cover multiple invaders, including listeria. Add to that preventative 48-hour antibiotics for at-risk preterm babies, and the fortress remains totally secure.
It really is remarkable. The combined power of proactive prenatal screening, rapid postnatal diagnostics, and just basic hygiene entirely transforms what would otherwise be a terrifying microscopic heist into a battle we can consistently win. By understanding exactly how these pathogens operate, expecting parents and clinicians are fully empowered to shield the most vulnerable among us.
But with these invaders constantly evolving, how will emerging antibiotic resistance change the way we protect the next generation? Thank you so much for joining me to explore this explainer today. Keep learning and stay curious.